Hey everyone, it's Dr. Mike, and I haven't posted a video in a while, so I wanted to take this opportunity to get back on track. And if you don't mind, I'm just going to talk a few moments about the 3 silent mistakes killing your chances for physician referrals. And this is to our medical exercise professionals out there. Now, your job is to provide safe and effective exercise after the client is finished with physical therapy or chiropractic care, occupational therapy. Your role is to provide those services, no treatment, no therapy, but just good, safe, and effective exercise that impacts on the client's functional capabilities. So there's a huge need for that. But we find there are 3 silent mistakes that you're making that are killing your ability to establish referral relationships. If you don't mind, I'm going to talk about those 3 real quick. Number 1, you look and sound like a fitness professional and not a health and wellness professional. And I understand you've trained as a personal trainer. You've spent most of your time as a personal trainer. Now you're making that transition. This is why we ask you in our medical exercise specialist and our post-rehab conditioning specialist courses to do those observation hours in a sports medicine, physical therapy, or chiropractic setting. And we normally ask you to do 10 hours. We're going to ask you to do even more. We recommend you do more because the more you understand how you fit into the whole medical management process, the better off you are. And you also, while doing those observation hours, it gives you a better understanding of what the therapist or the chiropractor are doing, how they're managing the client, how you can actually start to connect into that world and better manage the client. And you stop looking like a fitness professional or personal trainer and more like a medical exercise professional. Number 2, you don't speak their language. And what I mean by that is not just simply medical terminology. You're speaking exercise, and the medical community is speaking function and medical management. Again, spending more time in a sports medicine, physical therapy, or chiropractic clinic will give you a better understanding. And number 3, you haven't built that trust that makes referrals safe for the medical professional. Now, folks, please remember, if they refer a client to you and you do something that is completely insane and injures the client, they do have an interest in this and they do have some liability for making a referral. So you want to make sure that as you're communicating with the doctors, the therapists, and chiropractors, that you're making sure that they understand you're going to do what's safe and effective for the client. You're not going to try the most intense exercise or the most outrageous exercise, but you're going to work with the client and have a steady improvement along the way in their function as you apply exercise. And notice what I'm saying, the application of exercise. So with that said, on this coming Friday, we're going to start talking about how to make your medical exercise training practice referral ready in 30 days. We're going to do a 30-day challenge. And each day of those 30 days, we're going to give you a new component to add to your practice to make your practice referral ready, as in getting referrals from medical professionals. I know for many of you out there that have completed our MESs or PRCS course, you're frustrated. You have your certification, you're qualified, but you can't get referrals. So if you don't mind, make sure you go over to crackingthecode.net, get registered for our free webinar this coming Friday, and we're going to talk about how you get your practice ready in 30 days to start obtaining or receiving referrals from the medical community. Again, it's a 30-day free challenge. It's offered by our Medical Exercise Specialist Network, and we look forward to seeing you on this coming Friday, noon Eastern Time. All the best. We'll see you Friday. Take care.